My name is Hannah Redley, and I'm the Executive Director of the Greater Peterborough Health Services Foundation. So the Greater Peterborough Health Services Foundation is building upon its legacy and continuing to improve healthcare in the community. For almost 30 years, this foundation has worked hard in the city and county of Peterborough to support healthcare. And now we're focusing on education, equipment, and research outside of the hospital that benefits everyone in the community. One of the things that is very unique about our foundation is we're focusing on very innovative programs and doing things that are often unique within the region and within all of Canada in some cases. We're focusing on innovative programs such as the Youth Sports Concussion Program, focusing on capital equipment and providing this to all of the clinics in the city and county, equipment that's not covered by government funding. And in all of this, we're working with a great partner with Primary Healthcare Services of Peterborough, with the family health teams, with everyone in the community working so hard to improve patient care. And we're proud to be a part of this initiative.
My name is Laura Bowden. I am the chair of the Greater Peterborough Health Services Foundation. The foundation is important because it provides funding for education, equipment, and research for primary care in our community.
My name is Janet McLeod, and I'm a board member with the Greater Peterborough Health Services Foundation. I was on the board originally when it was the St. Joseph's Care Foundation Board. Partnerships and working with other groups and individuals in the city to be as good as we can be and as strong as we can be with what resources we have is something that's really important to me.
My name is Sister Mary Conley. I'm a sister of St. Joseph. The foundation is important to me because it carries on the legacy of the Sisters of St. Joseph.
My name is Laura Kennedy, and I'm the Director of Public Relations for Primary Healthcare Services of Peterborough. So we service over 122,000 patients across the city and county of Peterborough through our 5 networked family health teams.
Hi, I'm Catherine Johnston, and I am an investment advisor with RBC Dominion Securities. I know in my own circumstances, my mom, she is sometimes shaky as she's had some strokes, and having a wheelchair there accessible at my doctor's office that's been provided by the foundation has been of great use to me, and I'm sure many others. And so there's been so much more information now available and a much higher profile and concern about concussions.
I'm the vice chair of the Health Services Foundation. The role of our foundation is to support the 5 local family health teams in the community. It's extremely important that we're able to do that through providing help with capital equipment, research, and education so that these family health teams can be extremely efficient in providing patients with the necessary health care. I think all of us in the community, whether through relatives, friends, or ourselves, have seen the impact of the positive nature of what our foundation can provide through the family health teams, and the feedback that we get from members of the community, knowing that we've played a role in that is very satisfying.
My name is Brenda Williams. I work for a subsidiary of the Canadian Medical Association, actually. I work with physicians, not as a physician, but I have a pretty good sense from my work with them on a fairly personal basis how hard they work. And since the foundation works with family health teams to acquire facilities and services to help make them more efficient, I see that as helping them in their workday.
Dr. Don Harter. I'm the physician lead for Peterborough's networked family health teams. The foundation raises money for capital equipment in doctors' offices, the kinds of things that doctors' offices wouldn't ordinarily provide. The foundation also plays a big role in raising money for educational purposes for allied health professionals. There have also been major projects run by the family health teams.
It's Dr. Rick Bennett. I'm a family physician here in Peterborough. As the chairman of Docs on Ice Peterborough 2012, I was extremely pleased that we selected the Greater Peterborough Health Services Foundation as our charity of choice. were able to mobilize an army of volunteers, and with very careful planning, we were able to put on an event that was unprecedented and brought together 800 physicians to Peterborough and raised over $200,000.
The health teams are so important for this community, and the foundation has, the initiative with the foundation has brought doctors to the community. And instead of starving for doctors, we're now on the forefront. It's great.
It makes healthcare accessible to all ages of people. Hannah Routley, the executive director, and the board of directors, I believe they're extremely committed to maintaining that initial mission and vision. I think that's really important.